Lindsay.
I'm Kelsey.
I'm Kylie.
I'm Deb.
And we are at the Senior Center today, and a lot of us have had clinical at the Senior Center for the past few months in clinics around town and in surrounding towns. We have enjoyed our time here for the past few months, and we've definitely learned a lot from our experience. Today we're going to present on understanding heart attacks.
And I'm going to start.
Okay.
So I'm going to present on non-modifiable risk factors and modifiable risk factors, but we'll start with non-modifiable, which means you can't change it, unfortunately. So age is a non-modifiable risk factor for a heart attack. 65 and older, you have an increased chance of having a heart attack or heart disease. Gender is one. Heart disease is known as a men's disease, although women develop it later in life and have worse outcomes. Family history is also a non-modifiable risk factor. If a family member has had heart disease or a heart attack before the age of 55, you are more likely to have one due to genetics. But if they had an event after the age of 55, it could be age-related and not genetics. And fourth, African Americans are more likely at risk. And now we'll go to modifiable risk factors, so you can change these things. You want to control your blood pressure. Blood pressure over 140/90 being left untreated is definitely putting you at risk. So you'll have to make healthy lifestyle changes to keep your blood pressure lower, or have a medical regimen that you follow. The second one is smoking, and that's the most preventable risk factor. Basically just don't smoke. There's more than twice the risk of developing cardiovascular disease compared to the non-smoker. High cholesterol is also a modifiable risk factor. LDL contributes to the buildup in your arteries that can contribute to a heart attack. So you want to keep your LDL below 70. High blood sugar is also one, or diabetes. A blood glucose higher than 125 is not good. Type 1 or type 2, so you want to control your diabetes and your blood sugar. You could do that by eating healthier or staying on your treatment regimen. And fifth is obesity.
Okay, so I'm going to first go over just the common heart attack symptoms. So they are chest pain or discomfort, and the pain may spread to your left arm or shoulder, jaw, neck, or back. Shortness of breath, fatigue, nausea, heartburn, or abdominal pain, lightheadedness or dizziness, and cold sweats. So there are some differences between the male and female symptoms. So for women, we're more likely to have symptoms such as shortness of breath, pain in the upper abdomen, nausea, back and jaw pain, and extreme fatigue. So we have more symptoms that can be attributed to other diseases, so you may not think of them as a heart attack, whereas men will have a lot of chest pain and pain in their shoulder and arm. So the biggest thing to remember is there is a variability of symptoms between every person, so each heart attack is different, and it's just really important to pay attention to your own body and your symptoms.
So, as Lindsay mentioned earlier, there are modifiable risk factors which you can prevent, and some ways to prevent them, as Lindsay mentioned, are to stop smoking, and some ways to do this are to make a plan, choose a method, and set your quit day. There's also online programs to help with quitting. You also want to keep a healthy diet, which involves fruits, vegetables, whole grain, high fiber, and you want to limit your saturated and trans fat, your cholesterol, your sugar, and your salt. You also want to lower your blood pressure. If you already have high blood pressure, you want to make sure you take your medications. You also want to decrease your salt intake and increase your physical activity. When increasing your physical activity, you want to aim for a total of 2 hours and 30 minutes of moderate intensity exercise per week. This involves like a brisk walk or biking. You also want to reduce your stress, and there's many ways to do this. You can listen to music, you can meditate, do yoga, walk, make art, or read a book. Anything that relaxes you that you enjoy doing is a good way to reduce your stress. You also want to limit your alcohol intake. If you do already drink, moderation is the key here. And if you don't already drink, then you don't want to start drinking.
Okay, so I'm going to talk about blood pressure measurements. As we mentioned before, it's very important to monitor your blood pressure. There is manual versus automatic. This is an example of a manual cuff, so you would need a stethoscope with this. If you do have automatic, which a lot of people do, it kind of does it itself. So with manual and automatic, you want to sit you want to be in a seated position with your feet side by side. And you want to make sure your cuff is proper fitting, so it should equal the 80% circumference of your upper arm. The lower edge of the cuff should be 1 inch above kind of like the middle of your arm. So there is an arrow actually on the cuff as well here, where it shows that it has to be pointed toward the artery. So that should be in the middle of your arm. So if you are doing manual, you want to inflate, make sure you have the stethoscope there before you start to inflate the cuff to around 180. You want to release the air and you want to listen to the kicking sound. So the first one you hear is your first number, which is the systolic, and then the last knocking sound you hear is the diastolic, so the number on the bottom. So this may take a few times, so don't be discouraged if you try it once and you can't get it. And then automatic, which a lot of people have, you want kind of like the same setup in the beginning, and the machine will basically do everything for you. So if the blood pressure is high, you do want to repeat it just to make sure it's accurate, and you want to wait a few minutes in between attempts. And manual often gives a more precise measurement if things are off. So it's kind of important to have a manual if your blood pressure seems to be off sometimes or not necessarily accurate when you do automatic.
So the last thing we want to go over is, I'm having a heart attack, what do I do? Maybe you've never had a heart attack before, so you don't really recognize what it feels like that first time. Regardless of that, if you feel funny, you feel that chest pain, maybe you feel the arm pain, any of the symptoms we went over, you don't want to wait. Time is muscle. Call for help. That's the first thing you want to do, because you don't know if at some point you might pass out. You want to have someone there that's nearby. If not, call 911. That should be your first move. If you're in a public setting, a lot of places will have an AED. It's an automatic defibrillator. So ask someone to run and grab that for you just in case. Next, you want to chew and swallow an aspirin. The reason you want to chew it is because it breaks it up and it allows it to absorb faster. Unless, of course, you're allergic or your doctor has told you for some reason that you shouldn't be taking aspirin. Some of you might be prescribed nitroglycerin. This is a medication that will relax all the blood vessels, and it'll allow more of the blood and the oxygen to get to your heart easier, so your heart doesn't have to work as hard for it. But the most important, and with the nitroglycerin, you can take it up to 3 times within 5 minutes, and it's hard to kind of keep count by yourself, so if someone is with you, you can ask them, can you count 5 minutes for me? Can you look at your watch? Can you tell me when 5 minutes is up? And have them help you with that. But your biggest weapon here is going to be to stay calm, and while you're waiting for help to come, make sure you're resting, try to breathe, try to stay as calm as you can, because the more you get worked up, the more oxygen your heart is going to need, and it's not exactly able to get enough of it right now, so stay calm. And I hope you guys learned something today. Thank you.